Sanbanani, Babugeli, Emakaya, welcome to everyone. Gulo uhlelo lethu esilithanda kakhulu holistic healthy living. Lapho sifundisana ngezempilo. Yes, you know that when it is this time and you are seeing my face, we are doing nothing other than learning more about our health so that we can take better decisions and informed decisions on how to actually live a healthy lifestyle. Remember, knowledge is power. You cannot do anything about something with which you know nothing about. That is why Ketina sinfundisa ngazo-ke ezempilo, so that you can actually take better responsibility of your health. Kanti-ke angeke size simoshe isikhathi, sizongena phakathi endabeni yethu that we started already last week, and this is breast cancer. You know, it is the month of October, and usually what happens is there is breast cancer awareness. Gonke lapho esihamba khona, you open this social media platform, on the TV, everywhere, we are just bringing awareness about breast cancer. So nathi-ke angeke size sisalele ngaphandle. So last week, I'm just going to give a quick recap and then we're going to continue, because the aim is to finish this breast cancer awareness. And remember, what we want at the end of the day is that sazi gabanzi about breast cancer. And so, and if you know, then you will know what to look out for. And if you know, you can also teach other people about breast cancer. This is a topic that is not only relevant and important for abantu besifazane, but it is also important for our male counterparts as well, because yes, it does not only directly affect females, it can also affect males. And yes, it may not affect them directly, but it definitely does affect them indirectly. That is why now, if ungumuntu wesilisa watching right now, please stay tuned. This topic is important for each and every single one of us. Now, last week we spoke about breast cancer, and what we said basically, because omunye umuntu lapha ekhaya is probably saying, yo, breast cancer asanke ngize ngibone last week and namuhla bayaqhubeka. No, not all hope is lost. We will do a quick recap, and you will definitely be on the same boat as everyone else that has tuned in. So, breast cancer, a quick recap. We said that last week breast cancer define cancer, and we said, you know what, there's this abnormal cells that are growing, and usually we know what, you know, within the DNA level there's something wrong. And so you get this abnormal growth of cells, and they akula fast, and they don't even die. You know, when it's time for the cells to actually, you know, die, and that doesn't happen. It's just a whole lot of abnormal cells that are growing, and these cells grow so much that they end up invading other structures in the body. And we said that is now metastases. And then we said, breast cancer in particular, you have this abnormal growth of cells in the breast tissue itself, and it can just stay there, or it can move to other parts of the body. We thereafter moved on and said, well, breast cancer, we can't really say what are the causes of breast cancer. Instead, we said that we can actually say what are the risk factors. We can't say particularly this particular thing causes breast cancer, but we can come up, we do know of risk factors. And sitize ama risk factors yilezo zinto lezo ezenza. When you have these risk factors, you are more likely of getting breast cancer as opposed to someone that does not have these risk factors. And we said it is very important. The risk factors doesn't mean ukuthi definitely uzoba nayo breast cancer, but it tells us ukuthi your chances of getting breast cancer are higher than a chance of someone else that does not have risk factors. We also did say, however, ukuthi if you don't have the risk factors, akusho ukuthi you will or you cannot get breast cancer. And at the same time, if you do have them, it doesn't say that 100% sure you will get it. So it is important to and understand that. And we then further went on to saying what are these risk factors, and we said konama risk factors that you can do something about, and there are risk factors that you can do nothing about. And we said briefly, your genetic risk factors is like your gender. If you're a female, obviously you're more prone to getting it than a male. And we said that age, so the risk of getting breast cancer, it increases as you actually grow older. And then we also said there's things like family history. If you have a family history, a positive family history of this, your risk factors are higher. We went on to talking about, your menstrual cycle. If it started early, we went on to talking about menopause, and if it starts late, and all of those things. We basically said that, they increase the chances of you getting breast cancer. We then moved on. We have what we call environmental risk factors, and these are the risk factors that you can actually do something about. And we did mention having a sedentary lifestyle, exercise, you have higher risk factors. Consuming alcohol, smoking, we spoke about being overweight or being obese, and we said all of these things really, they are risk factors to getting so they increase your chances of getting breast cancer. So thereafter, sakhuluma kabanzi ke about the importance of early detection. And by that, sisho ukuthi kubalulekile ukuthi i-breast cancer itholwe kusese early so that we can intervene early. And then sakhuluma ke about the importance of breast self-examination, because we do know that more than 40% of the breast cancers that have been diagnosed really, they stem from one going to the doctor and saying, yo doc, I am feeling a lump ebeleni lami kunento engayitholi kahle, or I'm having a nipple discharge, what is going on? And so then we got to the diagnosis of okay, the person actually has breast cancer. But it doesn't necessarily mean they all start like that or they all present like that. So now today, sizodwela more into the signs and symptoms of breast cancer. So, singakamoshikeke naso iskati. Firstly, ngiyathanda ukuthi siwa divide so that you're able to recall them better. And now the first heading, we're saying, if you see or if you feel any nipple changes or breast changes. All right. If wena umile mhlambe espilini or uyazibona and you are seeing ukuthi there is a change ngendlela your nipple looks like, or there is a change in the way that your breast looks like. So this one really entirely depends on what you see. And what are these kind of changes that we're talking about? One, these are how it feels. Firstly, it could feel tender, liphlungu, like nje, you know what, it's just so tender. You can feel that. Or you can feel a lump, isgaqa. Less gaqa, less it can be on the breast itself. It could be ngapasige kwapa, on the underarm area. Anyway, anywhere where you may feel a lump. Also, you may actually see ukuthi, you know what, le skin asisafani nangendlela esijwayele ukuthi sibe ngakhona. And we usually use what we call, orange ukuthi linjani. And usually you may find ukuthi the skin on the nipple looks like an orange. How does an orange look? You have all these dots, these pore-like things on an orange, and it may look like that, believe it or not. And so if you see something like that, it is very, very important ukuthi you actually go and you consult. You don't just take it at you go and you consult. And as we emphasized last week, it is important that you compare the left-hand side to the right-hand side. Into ega lefty, melibe khona ka righty. Uma you have now suddenly you are seeing ukuthi this lump iga left kuphela ka right ayikho, it's a cause for concern. So the best thing to do is you actually need to go and consult, as opposed to ukuthi ulinde uthi ayisizohamba. So remember sithini, if you are feeling it's tender or you are feeling isgaqa or you are seeing there are some nipple changes, you want to go and consult. Good. Now, the next very important class of signs is when you actually see that when you're looking at amabele wako, awasafani, left no right agasafani. So this is now when you actually have a change in the breast or the nipple. What kind of changes are we talking about exactly? One, you could see that the one breast is bigger than the other breast, like abnormally bigger, you know. So you see, okay, mhlampe laka left likhulu ukudlula laka right. So there could be a change in the size or the shape. Or you could see dimpling, dimples in Jena, anywhere on the breast. That is a cause for concern. And also, if you're seeing, you know, there is unexplained swelling on the, like, nothing happened, and and very important, it's only on the one side and not on the other. And also, you can find the one breast is enlarged, so it's swollen, or it has shrunk, like abnormally small, you know, not the usual size. And then, very important, as I mentioned earlier, you want to compare the two sides. Or left, no right, abasafani. I must say this, yes, we know, and it is very normal. Oguti, there are no two breasts that are exactly the same size. And that is okay. But once the one size is, the difference is just too big, and it's something that is abnormal to you, because we always say umuntu owazi umzimba wakhe kangcono is the actual person, all right? And so you know, okay, no, normally ibele lami, okay, this is the differences. But if ubona into ngayijwayelanga, if you're seeing anything that is abnormal, that is a call for concern, and you want to get it checked out. And then also, you may find the nipple, so la khona, it is inverted, so meaning it has gone in. You know, it could be inverted, or, you know, there could be an ulceration there. If you find anything like that, or you find that the areola, so the area around that, it is darker than what it usually is, or it is scaly, or it is red, anything that is outside of the normal that you are used to, you want to go and get it checked out. Okay, then the other set of signs that you want to look out for is where there is any nipple discharge. And I'm using the words any because it doesn't matter whether it is liquid, like a clear fluid, or it is bloody, or it is pussy, or it is milky. I mean, if you are not a woman that is breastfeeding, or a pregnant woman, and you're having this milky discharge, that should be a call for concern. We're not saying that is equal to breast cancer, but we're saying it is a call for concern and you want to have that checked out. All right, so if you're seeing it discharge on the nipple of any sort, whether it is clear, whether it is bloody, whether it is pussy, it really does not matter. Any kind of discharges from the nipple, you want to go and get it checked out. And so briefly, those are the signs and symptoms that we want to look out for. And now next, I'm going to talk about breast pain and a breast lump or cyst. So yes, other patients may present with breast pain. Does breast pain equal to breast cancer? Absolutely not. However, if you are feeling that, you know, there is this discomfort and there's tenderness in your breast, whether it's on the breast itself or on the underarm region, you need to, so this can be because of a number of reasons. However, if it is definitely a cause for concern. And so you take that and all the other signs and symptoms that you mentioned, you would probably want to get it checked out. But it is important there are many other things that can cause breast pain. Akusho ukuthi uma une breast pain, une pain ebeleni, that means you've got breast cancer. Absolutely not. So remember, all of these signs and symptoms we are mentioning, ukuthi uma uyakubona ukuthi okay, I'm having this, I'm having that, you tick on your list, yes, yes, no, 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 no. And then you actually can make an informed decision, okay, you know what, they mentioned all of these things, I think I need to go get checked out. And that's fine. You go get checked out, they say it's not breast cancer, that's okay. Or you get checked out and they say it's breast cancer and you picked it up early and there's so much that can be done. Remember, with any cancer, the earlier that we catch it, the more options we have in terms of treatment. That is why kubalulekile ukuthi we must have these kind of sessions where we teach each other the things that we need to know or look out for that may tell us this may or may not be a cancer. All right. Next is what we call a breast cyst. Now, a cyst may feel like iskaka, a lump. But basically, when now a clinical or a health professional examines it, they may find okay, it's actually a harmless fluid-filled sac, all right, rather than something that is cancerous or any other benign lump of cells. All right, so what are we saying? We're saying if it's a cyst is harmless, okay? It may feel like a lump. So, ingathi muyithinta uyizwe ngathi iyilump. I need to remember we said you feel okay, there's a lump on my breast. What do? You go to your nearest doctor and they examine you and they find, oh, actually this was not a lump, it's a cyst. So a cyst is harmless, it is not cancerous at all. So it is important when you feel iskaka ebeleni, you just want to go and get that checked out. All right. And then we spoke about the self-breast examination and the importance thereof. And I'm not even going to go through it, but rather just to quickly say, remind you, you first want to do it in front of the mirror. Remember, shirt off, bra off, you are looking in front of the mirror. So the first step involves you looking. And when you're looking, remember, if you're looking at the left breast, you want to take the left arm or the left hand and you pick it up. All right, and then you observe the left breast, and then you do the same thing you do on the left and you do it on the right. So that's the first step. You want to see, you want to look at it, and you check a wonkama angle. All right. If you have bigger breast, you want to lift up the breast. You want to make sure that you can see everything. The second step, we said it happens when you're taking a shower or when you are bathing, and you basically just want to feel. And once again, mawenza the left breast, uphakamise isandla saka lefty, all right, you just put it behind your head, and then you take your right hand, and we said divide ibele lako into 4. So that you make sure that you examine, you touch and you feel each and every single part of the breast. And ungakhohlwa nangaphansi kwekhwapha. So you will then go in any way, any direction, as long as you make sure you've examined the entire breast. And once again, what you do on the left-hand side, you also want to do it on the right-hand side, right? Good. And then we said the last part, it involves you lying down on a flat surface. It could be the bed, the pansy, it doesn't really matter. And once again, you will take a pillow, you just want to put it underneath yourself, and then hand again, we phakamisa, and you just want to feel that breast. Why do we want this one where ulele pansi? Because remember now, when you are lying down, everything gravity, right? Everything now sort of becomes spread out. The breast tissue will be nicely spread out, and you can feel all the different lumps and whatnot, or any abnormalities. It makes it easier to see it. Okay, now that we are done with that, the next part basically is we need to know ukuthi asithengenako-ke umuntu was diagnosed with breast cancer. What now? All right. Now we need to know ukuthi diagnosing breast cancer, it involves many modalities. All right. So you did the examination, and then you go to the healthcare professional. They will do a clinical examination, and thereafter they may also do an ultrasound. So basically, you just want to see the tissue in the breast. You may do what we call a mammogram, which is specifically to examine the breast in detail. And we say every woman over the age of 40, you really want to do a mammogram about once a year. All right. Now, depending on your risk factors, etc. So then you can do a mammogram. Other things that can be done is an MRI. Usually, masses figure good the part of an MRI. You want to check how far it has spread. Like the cancer, is it just still contained or has it spread to other organs? And also, we may do a biopsy because really you want to take a sample. So in a biopsy, you're taking a sample of the tissue that you think would this tissue is abnormal, and you want to go and you want to get histology, what we call histology. Basically, sithini ke ufuna ukuthi uthathe ipiece uyocheck myself abnormal na ngempela is this cancer or le lump lena is it non-cancerous. So that's why you do a biopsy. And it also, all of these things esizenzayo ziyasiza in what we're calling staging of the breast cancer. Why? Because the stage of the cancer determines ukuthi sizoyitreata kanjani. All right. And so just it is important for one to know ukuthi one, you've got different types of stages, and depending on the types of stages, there are certain treatments that are done. One. Secondly, there are also different types of breast cancers, and once again, depending on the types, there is a treatment. But I in depth ngalogo. All right, you just need to know ukuthi once your breast cancer is diagnosed, there are certain other things that may be done, examinations, so that they will help in staging the cancer. Is it stage 1? Is it stage 2? Is it stage 3? Is it stage 4? You want to know that, all right? And then you also kanti ke futhi mawungena kuyu 1 no 2 no 3, there are also other stages ngaphakathi lapho. And also you want to then know ukuthi what type of a breast cancer is it, and how then will we treat this type of a breast cancer. And as you can also see on the screen, there are many types of breast cancers, and that we won't go into detail. You just need to know ukuthi I'm a breast cancer now. As much as they are all breast cancers, there are different types of breast cancers. And then the next thing that we want to then know is how then, doc, do we treat this breast cancer? Well, once again, there are many modalities, kuneyindlela eziningi ezikhona zokutreata i-breast cancer. You know, we're talking things from surgery. That is, if the breast cancer, you know, we can excise it, meaning singayisika and siyisike yonke sazi ukuthi akukho kusalayo. But that's again in your earlier stages of your breast cancer. Once it is advanced, usually we cannot do that, and that surgery is called a mastectomy. That is when you go and you really cut out the breast tissue. If it's on the one breast, you can cut out the one and leave the other. If it's on both, you may need to remove amabele wonke completely. So there is surgery. Also, there is radiation therapy, and usually radiation is used to what? To shrink the cancer, all right? You want to shrink it maybe so that you can do surgery later on, or you just, you know, there's really, you can't do surgery, but you really want to slow the progression of the disease, or ufuna ukuyibamba la ikhona khona ukuthi ingaqhubeki ibe worse ukuya phambili. You can also have hormonal therapy, you can also have chemotherapy and other therapies, you know, that are there to really just all in treating breast cancer. Okay, now the important part. So now we know what is breast cancer. We know the signs and symptoms of breast cancer. We know the importance of early detection. And we know that, you know, as much as we call it breast cancer, there are different types of breast cancers. And in all of these different types, there are different treatment modalities. And we also know there are many stages of breast cancer. And really, they are all treated differently. But we know the earlier you get it, the earlier we catch it, the more options, all right, that the patient has. Now, we're going to talk about myths, common myths that are around breast cancer. And really, we're going to discuss each and every single one of them. And why are they called myths? Because really they are believed to be true. But scientifically, we find that is not the case. Kantige, we do see you online on Facebook, and we will definitely be taking the questions and taking the comments as we go. So and definitely I'm actually gonna do now shout outs that are there on Facebook. People are really typing, and we love that, we love that, we love that. Okay, so before we get there, I'm just going to take a question we see here. So Mapanga Nomtandazo says, is a mammogram advised for someone below 40? And the answer is yes. All right. Why am I saying yes? It depends on whether or not you have risk factors. And we will also touch on to this later. Remember, we are not saying abantu that get breast cancer are people that are 40 years and above. Okay. Instead, even younger people can get a breast cancer. So if there are the risk factors and it is a cause for concern and we want to investigate further, then yes, definitely the doctor may then recommend or refer you to go and do a mammogram. I am also seeing another question that says, if my sister had breast cancer, does it mean I will have breast cancer too? And the answer is no. So what that means is you have a positive family history of breast cancer, but it does not mean that you will definitely have breast cancer because your sister had breast cancer. But what it does tell us is that your chances of getting breast cancer are higher, but it doesn't necessarily equal to you getting breast cancer. All right, now we're going to move on to the myths that I mentioned earlier. Uguti, there are myths that are surrounding breast cancer and whether or not they are true. All right, so the first one that we want to talk about. Finding a lump in your breast means you have breast cancer? And no, that is not the case. Njoba besishilo earlier, uma uzo uneskaqa, and you know, let's get the list. This is a site in one, the other side as kaka. What do you want to do? You want to go to your doctor, your nearest doctor. You can go a clinic, anywhere where you know you can receive health treatment, and they will get you checked out. And then if there's a need for further tests, then your healthcare professional will advise you accordingly, and then they will assist you accordingly. The second myth says men do not get breast cancer. It affects women only. And the answer to that, and we know that that is not true, because I did say earlier, Oguti, as much as breast cancer is more common in women, but it is very rare, meaning ayenzegi like often, but it can happen. And omunye uthi why? Because abantu besilisa abanamabele. Well, sir, abantu besilisa also have what we call breast tissue, ne? And that is why abantu besilisa can also get a breast cancer. As I said, it is very, very rare, but it doesn't mean uguti it cannot happen in male. Why? Because males also have breast tissue. So yes, believe it or not, girls and boys, the ladies, gentlemen, all of us, we have got breast tissue. So no, you are not excluded from breast cancer. However, it is very rare. Okay. So now you know, next time uzwa about umuntu wesilisa that has breast cancer, or you come across one, you won't be like, really? Yes, really. Because you know from Holistic Healthy Living that male and females have breast tissue. Okay. Now the next myth, which is quite a sad one, it says a mammogram can cause breast cancer to spread. No. No. No, because we actually use that, right? Or could say, you know, maybe, you know, people will be like, yeah, because it's, you know, because amabelako go in it. So how it is, if you don't know a mammogram or you have never seen or how it works, so you have, okay, you have these two plates, okay, ziganje, all right, and then ibele lakho lingena ngaphakathi kwayo, and then yoniya squisha so yabo, and then with all the technology, you know, it can really see the breast, and then we get images of how it looks and what is in there, etc. So people will be like, yeah, because it squishes and everything, it can squash this cancer. That is not the case, and it is used as a modality to monitor the progression of disease, to diagnose it, and also a screening tool. Okay. The next myth says, if you have a family history of breast cancer, you are likely to develop cancer too. This, it's similar to the question that if my sister has breast cancer, does that mean I'm going to have breast cancer too? So having a family history, so that just simply means that your chances or your risk factors, remember, you are more likely to get it. It doesn't mean definitely naganjani you will get it. All right. Okay, next is breast cancer is contagious, meaning if kudomuto breast cancer, it can, you can get it by touching a person with breast cancer. No, it is not contagious. Unlike example, chicken pox. You know, if you haven't been vaccinated for chicken pox, let's say chicken pox, and then here you are, someone has chicken pox, and you've never had chicken pox before, and you know, whether it's through touch or secretion, whatever, you will get that chicken pox. No, that is not how it works with breast cancer. Okay, right. Why? You know now, Uguti, it's something that happens at the DNA level. See, Kulumi Lelenda Bala Uguti, you know, our cells on the DNA level, they are abnormal, etc. We can't even see DNA. So, you know, that is how it goes. Okay, so, I mean, with the naked eye. So then, I mean, it's not contagious. No. Okay. Ezinye zalezinto I must say kusuhleke kancane, but then again we are here ukuthi sifundisane, and so we know good to know breast cancer is not contagious. You can nurse someone with breast cancer, you will not get that breast cancer. All right, the next one says, if the gene mutation of the BRCA1 or BRCA2 is detected in your DNA, you will definitely develop breast cancer. Well, that is also not true. So why are we saying that? Because we know that in more than 90%, well, in most people that have got breast cancer, when a biopsy is taken and the cells are looking and, you know, histology is done, what has been found is that there is a mutation in this BRCA gene. Okay, but I wish you would again. All people have a mutation in this BRCA gene. That is why we're saying if you have a mutation in that, definitely naganjani you will get a breast cancer. Yes, your chances are extremely high. They are higher than, they are really, really high. But we're not saying just because there's a mutation, then definitely you're going to get the cancer. All right, because as I said, the people that have breast cancer, they do not have this mutation in the BRCA genes. Okay. And then the next one says antiperspirants and deodorants can cause breast cancer, and that is not true. It actually goes on as far, abanye abantu even go as far as saying, well, you know, wearing a bra with an underwire can cause breast cancer. No, that is not true. Now, Mbugeli Amakaya, now that you know the common myths, all right, why are we letting you know the common myths? We are telling you the common myths so that you know, but oh, okay, no, that is not true. I remember Basho, and they said that it is not true. It does not work like that. I am once again going to go and check on the questions that you guys are giving us. And really, it is amazing to see all of the interaction. And I'm just going to give out a shout out to Zinhle Ndabandaba Mashinini. Thank you very much for watching. We can see you. Nomtanda Zamapanga Mazet Mtiane. Welcome to the show. We hope that you guys are learning. I can see Lufuno Spesike also tuned in. And we also have a Bishop Simpiwe Eduma. To everyone, thank you so much for watching. Please do continue watching. Now, we're going to talk about healthy habits, or rather habits that you really, remember we said when we spoke about the risk factors, there are things that you can do something about, and there are things that you can do absolutely nothing about. And so it is very important to have healthy habits that you actually practice. Why? Because these will not prevent breast cancer. And this is very important because, you know, we get the question a lot, how can I prevent breast cancer? We cannot give you, you know, like for example, sage sakhuluma lana about cervical cancer. And we said, actually, we can prevent what is called HPV, and we said, and usually what we do with that, we give them a vaccine that can prevent HPV. And, you know, in that way you can, you know, prevent getting the cervical cancer. There is no such a thing with breast cancer. Meaning we don't have a vaccine that we can give that will help you ukuthi umuntu angatholi breast cancer, or hormone therapy that will help ukuthi umuntu angatholi breast cancer. Instead, there are habits that we definitely advise ukuthi you want to do these habits, or you want to incorporate them into your life. All right, so what are we saying? We're saying that yes, we cannot prevent breast cancer, but there's definitely something that we can do. One, you want to maintain a healthy weight. Okay, and so last week, I also shared the importance of what we call BMI, your body mass index. And I also said, how do you calculate your BMI? You need your weight, you need your height, and then you actually going to take your weight and you're going to divide it by your height in meters squared. And that gives you your BMI. And I also said, so what does this tell us? If wena umude and then weigh 60, bese umngani wakho mfisha and weigh 60, akusho ukuthi no tuna, that is the right weight for your height. All right, so it is important to go to, when we do the weight, we look at the weight relative to the height. Umuntu omfisha, so what does that mean? That means umuntu omfisha, all right, cannot get away with a weight of 70, as opposed to a tall person with a weight of 70. You calculate the BMI, and the BMI tells us, are you underweight? Are you within the normal ranges of the weight? Are you overweight? Are you obese? Or are you morbidly obese? And so it is very important that you maintain a normal weight. Normal weight means you want to be within the normal ranges of the BMI, usually between 18 and 25. All right, because so yeah, it's healthy. Between 18 and 25, you can go as far as 28. Then you're okay. That is the weight that you want to get to. And please, these numbers, we're not saying umeskalin iti 18 or iti 25. No, this is when you have taken your weight and you divided it by your height, all right, in meters squared. That gives you your BMI. Okay, so you want to maintain a healthy weight, a good weight for your height. Secondly, you want to stay physically active. One of the ways that you can actually maintain a good weight is to be active. We did say having a sedentary lifestyle is just not good. It is not good for a lot of things. That is why you guys are always saying the same things over and over again, and well, actually it is the truth. More often than not, we are repeating these things. That is, they're so important. You will hear in the next coming shows when we're talking about high blood pressure, and you will hear weight is important. You know, being physically active is important. We're talking about diabetes, it is still important. So basically, every way, in every condition, maintaining a good weight, it is extremely, extremely important. So you want to have a good weight and you want to be physically active. What are the recommendations? You want to have at least 30 minutes of activity 5 days, at least 5 days a week. All right, so 30 minutes of extraneous exercise at least 5 days a week. So now, Zibu Zembugele Amakaya, are you doing that? Are you at least exercising for 30 minutes? If not, then you want to change that. Okay, and remember, this doesn't just help with your weight, it helps with the health, you know, related to the weight. And it also, definitely, you will look good and you will feel good, you will be good. Okay, also, important, you want to eat right. diet yakho, let it not be filled with fat. So you want to have a less fatty diet, all right? Instead, you want to eat a lot of fruit. You also want to eat a lot of vegetables. So it is very important. And also, you want to drink lots and lots of water. It is important, you know. The diet, it plays a big role. So, ungaphisa mafuta, instead, udla a lot of fruits and you eat a lot of vegetables. Then, very, very important, you want to stop smoking, because smoking is a risk factor for a whole lot of conditions. And so particularly now with breast cancer, you want to stop smoking. So remember, these are the things that you can actually do something about. And together with smoking, you want to limit or reduce your alcohol consumption. So ufuna ukunciphisa the amount of alcohol that you drink, utshwala ophuzayo. And if uhlanganisa zonke lezi zinto lezi, you are doing really the best that you can in trying not in reducing the risk factors of getting breast cancer. And that is breast cancer. So before we close the show, I will once again check with you guys that are texting us online, with you guys that are asking questions online, and see ukuthi did we not miss any question, because you know sometimes we may miss questions in between. All right, so I see ukuthi we do not have any new questions. That being said, we have come to the end of our breast cancer series. It was a 2-episode breast cancer series, and we've broken it apart so that we don't give you a lot of information. Instead, we give you a bit of information and we give you another bit of information. This being said, on our side from Holistic Healthy Living, siyabonga kakhulu that you were able to join us, and we trust and hope that you learned a bit more about breast cancer. And now that you know, you will be able to pick it up, whether on yourself or and even on others, and you want to really bring about awareness. Remember, we are teaching you, reaching out to you so that you can reach out to others. In that way, we get an educated and knowledgeable community, because really we do perish if we do not have knowledge. So now you know better. So once again, with breast cancer, singakhohlwa, it is not limited to females only, but it is more common in females. And if you do have it, well, you definitely need to go. You get it treated. And we didn't really get into talking about the prognosis. Those are things that would be discussed with you if you definitely do, if you are diagnosed with it. This being said, please, if you see something engafani naloko kujwayele, anything out of the norm, our message to you is go and get it checked out. It could just be iskaka, it's nothing, or it's just, you know, it discharge on the nipple and it's nothing. Do not say it's nothing. Go and get it checked out. And if your doctor says it's nothing, then you can breathe a little. But still, if it persists, you want to definitely go back again and make double sure, triple sure, it is not it. And on our side from Holistic Healthy Living, siyabonga kakhulu kuba ababukeli emakhaya that were able to join us on this show. Siyacela ke ukuthi singakhohlwa, we are still in a pandemic. Yes, we may have now be good the lockdown level 1, but it doesn't mean that COVID-19 does no longer exist. Therefore, we are saying, please do not forget to sanitize, do not forget to keep a safe social distance, and do not forget to wear your mask. In fact, we do know, Uguti, there has been, you know, the number of cases being reported, but in the past couple of days, they have been going back up. So that means, Uguti, you know, people are still contracting COVID-19. So please let us stay safe and be healthy. On our side, on Holistic Healthy Living, siyabonga kakhulu, asihlanganeni again next week, same time, same place. Thank you.